Today we interview Barbara, who is an Italian naturopathic doctor and culinary nutritionist. She works in the Hague area and her services are reimbursed by most healthcare insurances. Barbara, can you please explain what kind of services do you provide?
Most of the people who come to see me are dealing with an emotional or physical ailment for a long time without reliable results. And the reason to see me instead of their GP is because they normally have already done all the medical check and tried some therapies that for some reason didn't work for them. Or they might have developed some side effects or allergies to medications. Naturopathic medicine in this case can help because can underline the root causes of the problem and solve it.
And how is it possible?
Because the body is much more intelligent than what we think. And if we find out the reason why it is temporarily not functional, we understand the root underneath and we can pick up the remedy that is specific, solving the balance again. To give you an example of a naturopathic approach to a common ailment such as diabetes, it is not bad luck or bad genes that cause diabetes. Most of the time it's just wrong eating habits for years and years, and also ignore the symptoms because pre-diabetes syndrome are very different from person to person and often are according to family predispositions. However, in naturopathic medicine we can see that because we work on the prevention and solution of chronic ailments. So it is possible to see the family predisposition and knowing that person is exposed. In that case, a lot can be done, supporting the pancreas, especially his hormonal action, and after that, combining it with an eating plan, a specialized one, because we don't have magic pills. And to solve the pre-diabetes, basically in every kind of alternative medicine treatment, you also have to combine eating plan, personalized eating plan, in order to solve the problem.
So are you saying that everybody needs to change their eating habits? Even vegetarians or people who come for headache or back pain?
Naturopathic medicine shows that we are what we eat. So in my 14 years of practice, I always saw that food intolerances are the root cause of many chronic ailments, such as emotional or physical ailments. Why the emotions need to be considered as well. If the reason of your depression is because you don't take the time for a walk or just to express a little bit yourself, there's no antidepressant that can help you for this kind of depression. Or if you have a depression because of a lack of serotonin, the happiness hormone, also very often with the precursor of serotonin that is found in many food, you can solve it, so with good mood food, for instance. However, if the depression is caused by other causes, such as, for instance, a bad experience or a trauma in your life, in that case, back remedies are used in naturopathic medicine to treat the root cause and bring the balance again. So that's why the number of psychologists nowadays using Bach flowers are on increase, because they have no side effects and they can treat also babies and pets. To reply to your question about the chronic back pain or headache, most of the people who come to see me already check if they had some posture problem, maybe with an ergonomist, or have done all the exams with the physicians, but something didn't show their problem. In that case, for us, it's easy to recognize that it has to be related with inflammation, which is inflammation of tendons and muscles, which is called basically tissue acidity inflammation.
Can you say what are the causes, such as tissue acidity, for instance? What is your diagnostic tool?
I use an iridoscope, which is a machine very similar to the one used by opticians. And in that one you can see the iris, which is the colored part around the pupil, and there you can find a map of organs and systems.
Okay, so what do you see looking in the eyes? Hearted shaped heart, liver shaped liver?
No, not really. You have to think of the enlargement of the iris like with pattern. In the one, you can see, for instance, that it's very tight, and if it's very tight, it's probably a sign of cramps, tensions, or pain. You might see some holes, and in that case is a weakness in that area. You might see a lot of stains, and these stains are the one that I mentioned before. These stains are the one that are sign of acidity, and according to their color I can see which kind of acidity is there. To give you an example with some pictures, here you can see the white spots that look a little bit like snowflakes, and these ones are all around the lymphatic circle. So normally you have this in patients that have a predisposition to cancer. But in this phase, a lot of things can be done, because if you clean the lymphatic system and prevent it to get dirty again, this person is safe. Normally what you see is stains related to food intolerances. And just to give you an example, last month I saw 2 clients with the same problem, acid reflux, which is also called heartburn. And they both had this, but with totally different picture. One showed that the ring of the stomach was really acidic, and also a little spot on the ulcer. In that case, indeed, the acid reflux was caused by what he was eating. And I sent him home just with a specific eating plan, and after 1 week he called me to say that he's not taking antacids anymore. So this was easy. The other one had a normal ring of the stomach, but had some spots on the pancreas and a little hole in the area of the gallbladder. The spots on the pancreas show that was a lack of pancreatic enzymes, and the little hole on the gallbladder showed that actually in her case the problem was also a little production of bile, a lack of production of bile. You know that black, darkish, horrible taste liquid that comes out when you vomit, which is not nice? That is the bile. It's very useful when it comes to digestion, and in her case the acid reflux was due to the lack of these 2 things that help digestion.
And is this diagnostic tool effective? How often do you recognize the root cause of symptoms, and how do you decide what remedies to prescribe?
Most of the time you can see the iris clearly. You can see through them. So one time is enough, because you see the family predisposition, their tendencies, and you send them home with a plan to help them to cope with their predispositions. However, sometimes the stains are so thick that you cannot see underneath the pattern of the iris. In that case, you need more than 1 appointment, because first you remove the stains with all these acids I mentioned before, and then it's possible to see the predispositions and work with them. But in any case, the recommended therapy is always according to goals and expectations of the clients.
Yes, if a client who is under a therapy comes to you while taking drugs prescribed by his GP, do you recommend to stop the medications?
No. If a client is coming because he has diabetes but is not yet insulin dependent, still a lot can be done to help the pancreas and its hormonal values to balance again. But we need in this case also to put the client on a very strict diet, in order that when he will go for the annual check to the GP, the blood test will show his values drop. And in that case, it will be the GP to decide if it is the case to diminish the medication or even to stop it according to the results. I'm not a physician, I'm a naturopathic doctor, so I don't prescribe medicines, I help the system to clean and to keep it clean. The system is the blood, lymph and the organs. And to give you one example, in some clinics, United States, Australia, Swiss, maybe somewhere else, I don't know, naturopathic doctors work together with physicians, because when a surgery or an invasive therapy is necessary, it's also important to support the system, so support the blood, the lymph, and to see if the organs can stand it.
Is there any scientific base that supports naturopathic medicine?
Naturopathic medicine was the mother of medicine. As I said, Hippocrates was the one who introduced naturopathic medicine, thinking that we are what we eat. Nowadays, fortunately, psychoneuroimmunology, which is a new branch of immunology, and epigenetic, a new branch of genetics, show that indeed we are what we eat. The food plays a crucial role in our life, and especially in our health. And a lot can be done to keep the system clean. So yes, we have now the scientific credibility. Candace Pert, who is the pioneer of psychoneuroimmunology, and Bruce Lipton, the pioneer of epigenetic in the United States, they see that results are possible only if there's periodical cleaning. And what makes me enthusiastic is the fact that also the last researchers on cancer revealed that if your system is clean, if your lymphatic system is clean and your body is pH balanced and oxygenated, no illness can occur. Because these kind of nightmares do appear when the system has a lack of oxygen or there's acidity. And this is a great news, because then a lot of things can be done in prevention.
Do you find skepticism in your clients?
A lot. But for me it's a good sign. Skeptical people just want results. So they will be very committed to show you are wrong. What you're saying doesn't make any sense. But once they achieve the results, they are your best friends. So actually, my only nightmare are not skeptical people. My nightmare are people who are not committed, not motivated. Yeah, changing eating habits can be very compelling. And people who are basically not ready for the change. So this one, are, in my opinion, looking only for the magic pill, and we don't have many.
Okay, last question. I want to ask you something more personal. I heard you often today talking about eating habits. Are you vegetarian?
Eating healthy doesn't mean living on raw grains like birds or on raw carrots like rabbits in a barren land. I'm Type O, which means my ancestors were hunters. So I can tell you that, especially when winter comes, from time to time I enjoy to sink my teeth in a piece of juicy steak.
Okay, thank you very much, Barbara.
You're welcome.